Well, hello, everyone. This is Deidre Kindred, your nurse advocate, educator, and navigator. And I am super excited and supercharged to be back on Health Chats Among Friends tonight because I have two wonderful ladies here with me tonight. One is my co-host, Sue Wallace, and the other is Karen Curtis. But before we get into that, I'm going to have Miss Sue introduce herself and tell us a little bit about yourself, Sue.
Hey, well, hi everyone. I'm Sue Wallace, and most of you know that I was in the personal assistant service business for many years. And during that time, I became a certified senior advisor, and I actually did the advising for quite a few years, along with making sure we took care of everything with assisted services. But now I'm doing this full time, so I'm excited to hear Karen tonight. And I've just been around a long time. I've been about 30 years helping seniors and their families and advocating for them or helping them to advocate through different situations. So tickled to be here tonight. Thank you.
Awesome, awesome. And now, without further ado, we get to hear from Karen Curtis. So Karen, introduce yourself and tell us a little bit about you.
Thank you so much for inviting me to be with you and Sue tonight. It is a great honor and pleasure. And as an aside, I have to say, Deirdre and I have been working together on community education. And it's so this is really an extension of a passion that we share, which is helping people, everyday people who are confronted with a healthcare situation and realize, oh my gosh, this is so confusing. This is complicated. I don't know the language. I don't know the protocols. I don't know. I feel kind of lost. And as the founder of the Care Partner Project, which is an online resource for patients, but also really mostly for their family member caregivers who we call care partners. Because when any of us is that patient who is going through medical care or a medical crisis, we absolutely need an extra pair of eyes, ears, and hands, because I don't care how smart you may be at your job, how brilliant, when we are under stress, and healthcare is probably one of the most stressful things that you can go through. Healthcare, of course, it's positive when you're getting good news, but oftentimes you're dealing with bad news or potential problems, even down the road. And it's just, first of all, it takes your breath away, I think, for many people, but it also causes us to feel we don't hear as well. And I don't mean that physically hear as well. We don't take in information as well. We don't process it as quickly. So it's great to have someone by your side. And I think a lot of us do honor that if our loved one ever needs a hospital stay, for example, and we get that call from an emergency room, we're right there right away. But there's nothing in life that has ever trained us how to navigate the healthcare system in the first place, but then how to help our loved one and to be effective and confident and to know the language, for example. So that's what we do at the Care Partner Project. We have these quick guides that people can download for different situations, like for a hospital stay, for an emergency room visit, for childbirth, for surgery. We have one that's coming on board just this week, how to get to the correct diagnosis. And I could talk about that a little while later if you'd like, about why diagnosis is actually it's like a mystery hunt. It's like you have to put clues together sometimes to get to the right diagnosis.
Yes, absolutely. So Karen, share with us a little bit about your why, because everyone has a unique story, but your unique story led to the Care Partner Project. So would you share with us?
Oh, thank you. Well, like any family does, when a loved one, in this case, it was my dad, he was diagnosed with idiopathic pulmonary fibrosis, which is a disease that causes the lungs to, lung tissue to become inelastic. So you can't breathe. There's oxygen is an exchange, and the lung tissue is very brittle. And consequently, the person who has it basically slowly smothers to death. And there is no cure for it. There are no treatments for it. Actually, I should say there is a cure for it. A cure is a new lung. So a lung transplant is the only hope. And you're only considered for a lung transplant when you get to end stage, when you have very little time left. So we got to work when Dad was at end stage, petitioning 16 different transplant centers, where we put together a book, just like the books that you do for your clients, Deidre, that has all of the records. And we had letters from physicians that had been treating Dad, saying that he would be a good candidate for a number of reasons. We even had a map showing where he and Mom lived, and that if anything were to happen, like the very short drive it would be to get to the closest medical center. So he had every vitamin and drug he had ever taken going back to like 1950. He was the most organized person. And so eventually he was approved for a transplant at what I call Superstar Medical Center, because it was the #1 transplant facility in the country for heart and lungs. And miraculously, within 3 days of being listed on UNOS, he did receive the gift of a lung transplant, which in itself is a complete miracle. And he sailed through his surgery. The doctor said that his surgery, which took place in February, had gone so well that he could expect to be back out on the golf course by the 4th of July. And instead, on the 4th of July, he was battling his second round of MRSA, which is a deadly staph infection that had started. So within a few weeks of going home, he'd been walking in the hospital and took a fall, and it was on a Friday afternoon, and they put him in horizontal traction just to be on the safe side. And they said, we'll get a doctor to evaluate you just in case, you might have hit your head, there could be some neurological damage, but we'll have a neurologist evaluate you by dinner time Friday. And a neurologist didn't show up, and nobody showed up to evaluate him in horizontal traction until Sunday night. And that was when I absolutely lost it with the nursing station. And within 5 minutes, they did have somebody there to evaluate him. 5-minute evaluation. What's your wife's name? Who's the president? Follow this pencil. And he was cleared. But by then, he had developed pneumonia. And he was in, from being sedentary and horizontal. And so he was treated in the ICU, and it was there that he picked up MRSA. And then after MRSA, because of all the antibiotics they had given him, he picked up C. diff. And because he was in the ICU so much and not walking around, he picked up a DVT, and a blood clot.
Just spiral.
And so there was a spiral, yeah. So I was determined. We learned so much. He ended up passing away. He died 7 months after his lung transplant and never left the hospital. So about 2 months later, my husband went in for a routine bowel resection and ended up with sepsis, and he nearly died. So that was a year that we learned a lot about hospital infections and other kinds of cracks in care. And Um, and really the bottom line of all of this is there's really no one to blame because our staff is so stretched. So it's really important that those people, I look back on it now and I think, all those hours that I was sitting at the bedside, watching CNN or the Golf Channel with my dad, I could have been wiping down all the surfaces. I could have been making sure that everybody was washing their hands. I could have been using my bleach wipes to clean all of the tray table and all the levers in the restroom. All of these things that we teach people how to do on the Care Partner Project are as a result of the tough lessons that were learned when we didn't know what to do and bad things happened. All of these steps are very labor intensive and the staff just don't have the time to do them. Even until we have a nurse patient ratio of 1-to-1, which that's never going to happen.
Mm-hmm.
We need care partners who know what to do, know what to say, and when to get help.
Absolutely. Thank you for sharing that, because I know sometimes, all of our stories, because we all have them, can be really emotional, but it's wonderful when it leads to something to help the greater good, so you turned a tragedy into a flower, so to speak. I don't want to sound corny, but that's the way it happened.
Yes.
Yeah.
Yes.
So I want to say, and two, I love the Care Partner Project because those checklists are really efficient and they're really good. And my thing is that your goal is to partner everyone on the healthcare team. So meaning just because you are a husband, a wife, a daughter, and you're sitting at the bedside, doesn't mean you can't be a part of the team.
That's right.
Right? It's all about asking and, the alarm. Every piece of your Care Partner Project ties in with so many things that when I was working in the hospital as a nurse, I loved it when family members would ask me, what does that mean? What does that sign? Do I need to come and get you? Because it's so true. It's so many aspects. Alarm fatigue. The nurses are overworked and underpaid. You got other hospital staff in there that are coming through, and it's so much. We could talk for hours. Sue, did you have a question for Ms. Karen?
No, I was just so amazed at how your family handled this tragedy, because I've been involved in my family with a lung transplant also. And it was, they didn't want us to do anything, we're especially in that area. So, I'm just looking forward to looking at all these checklists, because I think that's so important to make it easy for people to do. They want to help. Most of them want to help. They just don't know number one, to ask. And then secondly, they don't know what to do. So with these checklists, that should be very helpful. So thank you for doing that.
Oh, well, thank you. I'm glad that you say that most people want to help, because I do think sometimes people hang back a little bit because it's intimidating. The atmosphere
Right.
is intimidating. And we try to have like a really friendly, upbeat, sort of casual tone, so that it feels like, well, of course, you're part of the team. Of course, that's your role. You can actually help the nurses. You can help the physicians by, doing all of these things that they know that need to be done, but just can never have the time to do it. It's just that safe care is just, it's not rocket science, but it's a lot of little steps that add up.
That's right.
Yeah. And so we actually have branched out from like what you can do in the hospital to one of the ones that we just published last week, I guess on September 17th, it was Global Patient Safety Day, and the focus was on maternal and infant actually childbirth safety, because I don't know how many people are aware of this, but the United States is the most dangerous place among all developed nations to deliver a baby.
Wow.
And the risks for women of color are 4 times the risk than they are for white women.
Yeah.
So we, to honor, this special day where the World Health Organization was shining a light on this global problem, but much more acute in the United States than it is for, say, Denmark, Canada, Australia,
Wow.
France, Germany, the UK. We're at the bottom of the rung. So
Would have never dreamed that.
yeah, so we have, and that's a case where oftentimes women do actually have a care partner. If they don't have a spouse or the dad who's with them, they'll have their mom, their best friend, somebody. That's kind of a natural situation. But we, in our checklist, alert them, as we do in all of our checklists, like, okay, what are the risks here? Where are there some concerns? And then this is what you can do. This is what you ask for. This is what you do. This is what you need to say. So it's really, and it covers pregnancy, childbirth, and then recovery afterwards.
That's awesome. Because even now in our season of COVID, the checklists are even more important. They were important before, but they're extremely important now because across the nation is different, and across city to city is different, and from hospital to hospital is different, and people feel alone, and it's so sad. And the people who are on the outside, i.e. your loved ones or your patient advocates, sometimes feel like one person per day, no exceptions. And I understand that, but at the same token, it's like, what can I do? Well, I can ensure that that person has that checklist with them, so this checklist, they cover so many different avenues, like preventing ventilator-associated pneumonia, or preventing blood clots, or preventing falls. I mean, your lists go on, and you even have one for COVID and alone, so to speak, so those are some great checklists, and I advise anybody to visit that Care Partner Project. It's a wonderful site.
Thank you very much.
Yes, true.
And you participated in helping to develop that.
Well, I wasn't going to say that. This is your baby.
No, that's the wonderful thing about the Care Partner Project, is that we have community educators like Deidre in about 34 different areas of the country, because we have community programs that last up to like anywhere from 30 minutes to an hour, depending on what the program is. And they're presented by professional patient advocates. So they're fully equipped to answer any questions that come up. And we tap into their expertise in developing some of the checklist guides that we have on our website, because they're in the trenches day in and day out, and they have the perspective of they're listening to the patients, they're understanding what's going on with families. They've been part of the healthcare system for many, many years, so they can bring together all perspectives. And that's really what we're trying to do, is we're trying to honor all perspectives. We're trying to honor our medical care providers, with the hope that if we have people who are coming into healthcare who are more informed, that it's going to make it easier for them. They're going to have people who understand how to take their medications, because they've got a care partner who's going to help them once they're discharged know how to take their medications and pick up their prescriptions. So then the care provider can rest easy.
That's excellent. That's so needed.
Yes.
Well, I think what you're doing is wonderful, Karen. I love it, love it, love it. And even I learned by teaching. So it's always room for improvement, but I just think everyone should visit that Care Partner Project. So if someone wanted to learn more about the Care Partner Project and how they can get involved, because there's other things on that Care Partner Project that we haven't even delved in that are very beneficial. But I wanted to ask you, what's the best way for someone to reach out to you, find more?
So our web address is it's thecarepartnerproject.org. thecarepartnerproject.org. But if you forget about the and you just put in carepartnerproject.org, it would still come to us. So no worries. And we have a contact form. So you would just drop a note. And we hope that people will come. And also on every page where there's a checklist guide, there's a little pop-up that says, hey, do you want this? You can download it. They're all free for download. And if you want to just do anything at all, we're always looking for volunteers. And for any ideas about other content that you'd like to see on it, that's always very helpful too. We love to get feedback. So we're trying to cover as many topics as we can, because none of us got any formal education in this. So we're trying to make up for that.
And it's just so funny when something hits home, whether you are a healthcare provider or not, you're still human and you still need a partner. So
Yes.
Thank you, Karen, for your time. Thank you, Sue, for attending.
That was excellent. I can't wait to find out more about this Care Partner project, because it just sounds like something that's so needed in our society. I did have one quick question. Are you just in the United States now, or have you gone beyond our borders?
We are just in the United States, and everything is written in English right now. We do have visitors from all over the world. I've had a nursing school in South Korea contacted me and asked if they could use our materials for nursing program there. We've had a patient safety organization in Australia contact us and want to use our materials. So, and I can tell our web traffic is coming a lot from the Middle East, the UK, and Australia.
Wonderful.
I don't know why.
Awesome. That's awesome.
That's so good.
Okay. Well, without further ado, thank you again, Karen, for your time. Thank you, Sue, also for helping me co-host. And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from your local communities. Tune in next time for another amazing chat with another amazing guest. Thank you again.
Thank you.